Hello everyone, my name is Diksha Deshmukh and this is my Global Environmental Health Project. My topic for today's presentation is cholera, the silent killer. The main objective of this project is to provide an overview of cholera and its impact on public health with the goal of advocating for the implementation of effective prevention and control measures among the public health officials, policymakers, medical professionals, and researchers. The table of contents. What is cholera? Cholera is a bacterial infection caused by the bacterium Vibrio cholerae that affects the intestines. It spreads through the ingestion of contaminated water or food and can cause severe diarrhea, vomiting, and dehydration. Cholera is a major public health concern in many parts of the world, particularly in the areas with poor sanitation and hygiene. Prevention and treatment of cholera involve improved sanitization, hygiene, and access to safe water and food. Now we discuss the history of cholera outbreaks. The first cholera pandemic took place between 1817 to 1824, originated in the Ganges Delta of the Indian subcontinent and spread to the Southeast Asia, the Middle East, Africa, and Europe, resulting in millions of deaths. The second cholera pandemic took place in 1829 to 1851, again spreading from India to Southeast Asia, the Middle East, Africa, and Europe, with the greatest impact being felt in Europe and North America. Eventually, the third cholera pandemic took place between 1852 to 1860, again spreading from India to Southeast Asia, Middle East, Africa, Europe, and eventually to South America as well, resulting in millions of deaths. Cholera in modern times, that is 1960 to present. Cholera continues to be a major public health concern with outbreaks occurring in Africa, Asia, and Latin America. The most recent outbreaks occurred in Yemen in 2016, resulting in over 1 million cases and 2,000 deaths. Cholera is caused by the bacterium Vibrio cholerae, and the symptoms are as follows: severe diarrhea, vomiting, dehydration, abdominal cramps, nausea, low blood pressure. The symptoms of cholera can range from mild to severe, and in severe cases, it can also cause shock, coma, and death. Prevention and control measures. Safe water and sanitation are crucial in preventing cholera as the disease is initially spread through contaminated water and food. Here are some ways in which safe water and sanitation can help prevent cholera. Access to safe water, prevention of sanitation facilities, hygiene practices, health education. Overall, safe water and sanitation are essential in preventing cholera and improving public health. By investing in these areas, we can help prevent outbreaks of cholera and other waterborne diseases and ensure that communities have access to basic necessities of life. Vaccination programs can play an important role in controlling cholera outbreaks by reducing the spread of disease and protecting vulnerable populations. Here are some ways in which vaccination programs can help prevent and control cholera outbreaks. Herd immunity, target vaccination, emergency vaccinations, vaccinating the travelers. There are several types of cholera vaccines available, including oral vaccine and injectable vaccines. The World Health Organization recommends the use of oral vaccines as a primary tool for cholera control, particularly in endemic areas and during outbreaks. To ensure the successful prevention and control of cholera, it is crucial to advocate for the effective implementation of preventive measures among public health officials and policymakers.
Collaboration and partnerships. Advocating for the effective implementation of preventive measures to control the disease is essential to improve and ensure the successful prevention and control of this disease. Here are some reasons why advocacy is important. Raising awareness. Advocacy can help raise awareness among public health officials, policymakers, and the general public about the importance of preventive measures to control cholera. This can help prioritize cholera prevention and control efforts and increase the allocation of resources towards these initiatives. Addressing gaps. Advocacy can also help identify gaps in existing prevention and control strategies and highlights areas that need improvement. This can lead to the development of more effective interventions, such as improved vaccination programs and water and sanitation initiatives. Building partnerships. Advocacy can help build partnerships between different stakeholders such as government, civil societies, organizations, and private sectors. This collaboration can help ensure that preventive measures are implemented effectively and that resources are utilized efficiently. Encouraging action. Advocacy can motivate policymakers to take action to prevent and control cholera outbreaks, such as investing in infrastructure improvements and promoting vaccination programs. This can lead to real world impact in reducing the spread of disease. To effectively advocate for the implementation of preventive measures, there are several actions that can be taken. First, engage with policymakers. Engaging with policymakers and other decision makers is critical in advocating for effective cholera prevention and control. This can lead providing them with evidence-based information about effectiveness of different interventions and working with them to develop policies and programs that prioritize cholera prevention and control. Raise public awareness. Raising public awareness about cholera prevention and control can also be a powerful advocacy tool. This can include using social media, organizing community events, and engaging with the media to disseminate information about the importance of vaccination, sanitation, and hygiene. Building partnerships with the stakeholders such as local NGO, community groups, and other organizations can help to amplify advocacy efforts and ensure that a diverse range of voices are included in the conversation. Monitor progress. It is important to monitor the progress in cholera prevention and control efforts and track the importance and impact of advocacy. This can help to identify success and areas for improvement and refine advocacy strategies to better address the needs of communities affected by cholera. In short, advocating for the effective implementation of preventive measures is crucial to control cholera outbreaks and prevent vulnerable diseases and population. By engaging with policymakers, raising public awareness, building partnerships, and monitoring progress, we can ensure that resources are allocated towards effective cholera prevention and control initiatives.
Advocating for the effective implementation of preventive measures to control cholera is essential to improve the successful prevention and control of the disease. Here are some reasons why advocacy is important. Raising awareness. Advocacy can help raise awareness among public health officials, policymakers, and the general public about the importance of preventive measures to control cholera. Addressing gaps. Advocacy can also help identify gaps in existing prevention and control strategies and highlight areas that need improvement. Building partnerships. It can help build partnerships between different stakeholders such as government, civil societies, organizations, and the private sector. This collaboration can help ensure the preventive measures are implemented effectively and the reasons are utilized efficiently. Encouraging actions. Advocacy can motivate policymakers to take action and prevent control cholera outbreaks, such as investing in infrastructure improvements and promoting vaccination programs. This can lead to real world impact in reducing the spread of disease. Thus, in conclusion, I would like to say that preventing and controlling cholera requires a multifaceted approach that involves vaccination programs, improvements in water and sanitation facilities, and effective implementation of preventive measures. Thank you so much for being kind and attentive. Have a good one.